Welcome to Med Madness, where we dive deep into critical medical topics to help you ace your exams and enhance your clinical knowledge. Today, we're exploring HELLP Syndrome, a severe and life-threatening condition that often complicates pregnancy. Understanding HELLP Syndrome is crucial for medical students and healthcare professionals, as early recognition and management can significantly improve outcomes for both the mother and the baby. In this episode, we'll cover the definition, causes, pathophysiology, symptoms, diagnosis, management, and a real-life case study to illustrate these concepts. Next, let's discuss what this condition is. HELLP syndrome stands for hemolysis, elevated liver enzymes, and low platelet count. It's a severe form of preeclampsia characterized by endothelial dysfunction, vasospasm, and systemic inflammation. Common causes and risk factors include abnormal placental development, the release of anti-angiogenic factors, and widespread maternal endothelial dysfunction. These factors contribute to hypertension, vasospasm, and microangiopathic hemolytic anemia. In HELLP syndrome, platelet overactivation leads to thrombocytopenia, while microthrombi deposition within capillaries causes red blood cell destruction. Moving on to symptoms and clinical presentation. Patients with HELLP syndrome often present with nausea, vomiting, right upper quadrant pain, headache, and visual disturbances. These symptoms are accompanied by hypertension and may include proteinuria. The right upper quadrant pain results from hepatic involvement, where microthrombi deposition in the hepatic portal system leads to decreased hepatic perfusion, liver ischemia, and hepatocellular injury. This injury causes the gradual distension of the hepatic glycan capsule, resulting in the characteristic right upper quadrant pain without peritoneal signs. Severe cases can progress to liver necrosis and hemorrhage, leading to subcapsular hematoma. Now let's talk about the diagnosis. Diagnosing HELLP syndrome involves a combination of clinical assessment and laboratory tests. Key diagnostic tools include blood tests revealing microangiopathic hemolytic anemia, elevated liver enzymes, and thrombocytopenia. Additional tests may show elevated indirect bilirubin levels and proteinuria. Imaging techniques like ultrasound can help assess liver involvement and rule out other potential causes of the symptoms. It's crucial to recognize the signs and symptoms early to initiate prompt treatment and prevent complications. Next, we come to management and treatment. The cornerstone of HELLP syndrome management is prompt delivery, as removing the placenta is the only definitive cure. Medical management includes administering magnesium sulfate for seizure prophylaxis and antihypertensives, such as hydralazine, to control blood pressure. It's essential to monitor the patient closely for complications, which can include abruptio placentae, subcapsular liver hematoma, acute renal failure, pulmonary edema, and disseminated intravascular coagulation, or DIC. In some cases, blood transfusions and other supportive measures may be necessary to stabilize the patient. Let's consider a real-world example to illustrate HELLP syndrome. A 35-year-old woman at 35 weeks gestation presents with severe right upper quadrant pain, nausea, and vomiting. She has a history of hypertension, which has been difficult to control during her pregnancy. On examination, she is found to have elevated blood pressure and proteinuria. Laboratory tests reveal microangiopathic hemolytic anemia, elevated liver enzymes, and thrombocytopenia, confirming the diagnosis of HELLP syndrome. Immediate steps are taken to stabilize her blood pressure and prevent seizures. The decision is made to proceed with delivery to prevent further complications. Post-delivery, the patient's condition gradually improves, and she is closely monitored for any signs of complications. In summary, HELLP syndrome is a severe complication of pregnancy that requires early recognition and prompt management to ensure the best outcomes for both mother and baby. Key points to remember include the characteristic symptoms, the importance of timely diagnosis through clinical assessment and laboratory tests, and the critical role of prompt delivery in management. To reinforce your learning, don't forget to engage with the pre- and post-podcast quizzes and review the Anki flashcards. These tools will help solidify your understanding and prepare you for any exams or clinical scenarios involving HELLP syndrome. Thank you for listening to Med Madness. Stay tuned for our next episode, where we continue to bring you essential medical knowledge in an engaging and informative format.